Hello, my name is Lindsay Missamore, and for my Health Educator project, I interviewed Mr. Bobby Davis from the Alachua County Health Department. He's the HIV and AIDS and STD coordinator there. Mr. Davis has a bachelor's in anthropology and a master's degree in health education, both which are from the University of Florida. Go Gators! Although Mr. Davis, his office is located at the Alachua County Health Department, his job description covers 16 counties. These counties include Putnam, which is where I'm from, and Alachua, which of course is where the county in which the university is located. He's also been employed with the public health sector in one form or another since 1975. As you can see from this slide, Mr. Davis does not deal directly with patients or clients. However, he has a very significant job. Personally, before meeting Mr. Davis, it was one area that I had never thought much about. Mr. Davis helps secure funds for the projects needed to educate and assist the people diagnosed with HIV and AIDS and STDs, and the programs that are also help needed to prevent the spread of these diseases. So basically, Mr. Davis deals with the administrative areas of health education, and let's face it, without the administrative faces of Mr. Davis and people like him, there would be no funding to help these people in need. For example, Walgreens, one of the Walgreens in Gainesville, has an HIV and AIDS and STD testing once a month, and the funds and some of the grants that Mr. Davis writes help fund the testing for this program. So you can see a day in his life at work consists of answering being on conference calls, answering emails, writing grants, and just trying to secure the general funds that are needed in order to make all these programs happen for the people that need them. I have to say, when I asked Mr. Davis about his health education philosophy, I was a little surprised at first. But after I thought about it for a few minutes, it made a lot of sense to me. Mr. Davis said, education is needed to cause a change, but will not cause one by itself. Like I said, when I started thinking about it, I thought, how many times have I known the correct way to do something in a situation and intentionally done the opposite? In our interview, he used the examples of smoking, wearing your seatbelts, and eating correctly. He said almost everyone knows smoking is bad, yet people still do it. Or people know they should wear their seatbelts when they're in the car, but they don't do it. And people know that eating correctly and getting exercise is important to maintain proper weight, but there's still so many overweight people. So with Mr. Davis's occupation being on helping to secure funds for educational purposes, I'm curious to see how all of you have benefited from this education. So here's a little trivia for you. The HIV virus can be transmitted by what means? A, drinking after someone, B, toilet seats, C, doorknobs, or D, none of these. I hope everyone was able to answer D. The HIV virus can only be transmitted through bodily fluids. It's kind of crazy. Growing up, I always heard about the HIV and AIDS epidemic, and it was hard for me to believe that people still think that the virus can be transmitted through casual contact. But Mr. Davis assures me that some people still think this way. Dispelling these myths are part of the many goals of Mr. Davis and the Alachua County Health Department. Although the education base is there, for most people anyway, some people still don't have all the facts. And through the funding received by the hard work of Mr. Davis and other people like him, the Alachua County Health Department can continue busting up the myths that people have concerning HIV and AIDS and STDs and replacing them with the truth. Another effort of the people in administration, like Mr. Bobby Davis, is they've helped to criminalize spreading HIV and AIDS unknowing to unknowing victims. Excuse me. Did you know that if you're infected with HIV and AIDS and have sex with another person, that it's required by law to let your partner know before you have sex that you're infected? Failure to do so is considered a first-degree felony, and it can be punished by up to 5 years in prison and a $4,000 fine. It's the responsibility of every citizen to take charge of their own sex life. However, not everyone is doing this, and that's the reason why the spread of HIV and AIDS continues as it does. There's absolutely no surprise at what Mr. Davis named as his biggest on-the-job challenge. Of course, it's money. As he says, the constant whittling away of funds and staff with the expectation to do more with less. He said people are living with HIV and AIDS longer due to more and better knowledge and more efficient medications, and although this is an absolutely amazing thing, it creates a huge strain on the already insufficient funds. At one time, people with HIV and AIDS were expected to live less than 20 years or so past their diagnosis, and now people are living well into their 70s when they take their medications properly. So, with this advancement in medication, people who have HIV and AIDS are needing help for longer periods of time, while the amount of people that are being infected and contracting the disease isn't slowing down much. So when you put these two together, it creates an enormous strain on the amount of funding needed to help keep up with medication help programs, educational programs, and things such as that. And as most people realize, it's often the goal of many agencies and companies to do more with less. In this case, being able to do more efficiently with less funding isn't a completely unreasonable goal. Along with the challenge of funding, Mr. Davis also mentioned that people are just not willing to make a change as part of as is challenging as well. They have the knowledge is there, but the desire to change is just not there yet. I've learned in several courses throughout my almost degree that people desire to change at different times, and their reasons to change are almost always different. So this was definitely a great real-world application of something that I've learned in class. It also tied in with Mr. Davis's health education philosophy about that even though the knowledge is there, the knowledge alone is not going to cause the change. It's needed to make it the change if it's ever going to happen, but just having the knowledge doesn't make the change. I put this quote in here because I thought it was really appropriate for our conversation when he said, "Challenges are what make life interesting. Overcoming them is what makes it meaningful." And I know after talking to Mr. Davis, it's meaningful work to him to be able to come up with the funds or to figure out ways where things can be downsized or funds can be reallocated in order to help the people that need the help the most. I asked Mr. Davis, had he seen any big changes in the way people view HIV and AIDS and STDs now as opposed to 5 to 10 years ago? And he answered basically with a simple no. And I can't say that I wasn't surprised at his answer whenever I heard it, because I was thinking there would be a big difference because medication advancements or people, I guess, growing in knowledge, I was thinking would be, a change. But he said that until we as a country, as a county, as a city are tired of HIV and AIDS and STDs or any other health issue for that matter, then we're not going to see a change. This was kind of a paradigm shift for me. For many years, I thought that people just continued to become infected because they didn't know any better. And yes, that's some of the problem, but many people know better, but they just don't care. And it's hard for me to think that people don't care about having such a horrible disease as HIV and AIDS just because, they don't care if they're infected with it. They don't care if they infect other people with it. And it's just sad to know that people don't care enough about themselves or about others so that a change can be seen. And as from the last slide, I found this quote and I thought it was appropriate as well. It says, "They say that time changes things, but you actually have to change them yourself." And that goes along with, Mr. Davis's health education philosophy. Just because you have the knowledge doesn't mean that you're ready to make the change, and just because you're ready to make the change doesn't mean that you do, but the knowledge must be there first in order to make that change. Otherwise, it can never be made. Mr. Davis and I also talked about what he would have done differently regarding going to school. He said he loves the public health field and he can't imagine himself doing anything different. But when he was in school, he wished that he would have taken more adult education classes. He said a lot of the classes they took were geared more towards health education in schools and school-age children. And while this knowledge is definitely useful, he's never worked with school-age children. So a lot of that knowledge that was gained there, he felt that he could have substituted maybe the adult education classes because that's what he's dealt with in his entire career. He said also business classes would be helpful or useful to him, or other people that are going into the administrative side of health education. It's important and useful to know how to write a grant. That's how much of the funding is obtained for getting the funds needed to help fund the classes that are so desperately needed. So it's important to know how to write a grant, to know how to allocate the funds from that grant, to know what takes priority, what should be paid first, what should be done first, what are the requirements of that grant, where do the funds have to go, what do they have to be used for, and also to know how to manage and treat employees. He also mentioned small group theory would have been beneficial because most of the work that's done is done through small groups, and a health educator would definitely need to know how to facilitate one of these groups. Mr. Davis, as I said, enjoys working in the health education and public health field and just can't imagine doing anything any different and can't imagine working anywhere else. I mean, he's had a 39-year career in the public health sector. He said he sees public health as a leader of primary, secondary, and tertiary care. Public health is what happens before you get to primary care. So public health is about preventing the problems and getting information before the person reaches the primary care level. I think that is an absolutely amazing goal as a health educator. If we could prevent all or even just some of the public health issues, such as preventing people from smoking or making sure people wear their seatbelts so they're safe in the car, making sure their children are correctly placed in car seats and the car seats are buckled in correctly, trying to prevent HIV and AIDS and STDs so they don't have to go, get these medications, these lifelong medications from their primary care doctor, then we've made a huge impact in the lives of so many people. And as you can see at the bottom, it has the primary, secondary, and tertiary care levels. So Mr. Davis's goal, and people like Mr. Davis, their goal is to completely eradicate the new cases of problem behavior, which, although it's an unreasonable goal to think they can eradicate all of it, they're trying to just eradicate as much as possible. I will say that I really enjoyed speaking to Mr. Davis about his 39-year career in public health. He was able to offer me a chance to see a different, although extremely important side of health education. As I said earlier, I had never really thought much about the administrative side. I thought more about dealing directly with the patients, dealing directly with the clients. I never really thought much about where's the money coming from to do all this. So I'm sure I can speak for many other people, or many people whose lives that have been impacted indirectly, in saying how thankful they are for Mr. Davis and people like him who go into the administrative side of public health and health education and being able to make all these programs possible through the funding that they receive so all these people can benefit from them. I'd like to thank you so much for listening and watching this presentation, and I hope everyone has a good evening. Thank you.